we're here to talk about. So.
Exactly. Thank God.
Yeah.
All right. So I'll do my part. I am Rebecca Kazin. I'm a board certified dermatologist practicing outside of Washington, D.C. And I am here to welcome Dr. Amelia Hausauer, who is a board certified dermatologist who works in Silicon Valley. She is also fellowship trained and does cosmetic, general, and surgical derm. She is on the editorial board of the Dermatologic Surgery Journal and the chair of the ASDS Patient Education Work Group. And we are here tonight through the True Skin Experts Live series to talk about hair loss solutions, which, as we both know, hair is a big deal for men and women and can definitely affect your day. So I just want to thank everyone who's joining now. We will try to kind of answer questions as we go and try to tailor this as to what everyone's interested in. But welcome, Dr. Hausauer.
Thank you. And I'm really excited to actually be here tonight. I was reviewing a paper earlier this afternoon that was talking about like the profound psychological impact of hair loss. And so I thought it was really appropriate given what we're talking about. I think it's something that, is considered benign. It's not something that's going to be typically harmful to your overall health, but has huge ramifications for how you interact with other people and your self-esteem. And so it's a really important topic.
I have seen some of the most amazing transformations just giving someone back, a little bit of their hair, men and women, but mostly women. It's something that you really can't hide, and it makes a big difference because you see it every day. And as you know, our hair is sort of like an outward extension of our health. And so, one of the things that we look at when we see hair loss is to see if there's anything else going on. What kind of workup do you do if someone comes in and says they're having hair loss, if any?
Yeah, so traditionally when someone comes in and we talk a lot about the history, how their hair loss started. Was it abrupt? Has it been going on for years? And I really like to get a lot of detail about the type of hair loss they're experiencing, how it's progressed over the time that they've noticed it. And for most people, if I have any questions about whether there is a larger systemic problem, so something that's affecting other organ systems, and they have other symptoms, I will do a specific workup for that. So one example might be lupus. People who have lupus often experience different types of hair loss. And so if there's anything that is a red flag for that, I'll do a specific workup. But in general, for patients, I will usually check some of their nutrient levels. So a lot of times when people come in complaining of hair loss, I'll look at their total body stores of iron, vitamin D, and zinc. Those are the three big ones that I frequently check because we know if you don't have enough of those nutrients and those building blocks, you're going to have more difficulty regrowing and producing healthy, robust hair.
Exactly. And I feel like thyroid's one that most people have already had checks, but I do think about it because I personally had I had postpartum autoimmune thyroiditis. So I was one of those people who was losing hair and had to get my thyroid checked and in check. So I definitely think about that too, especially in women.
Yeah, I almost always check that in women. I think sometimes in men it's a little bit easier because they come in and if you have androgenetic alopecia or like male pattern hair loss, a lot of times we can walk in the door and you can recognize that pattern because it's very clear, and that may not need the same type of workup. But especially in women where it's a little bit more, the pattern sometimes is a little bit more ambiguous, it's really important to look at those labs.
Definitely. So how do you go through the consultation when you determine that maybe it is just androgenetic alopecia? How do you go through talking about possible treatments?
So I typically I talk about treatments from like the least aggressive to the most aggressive or most invasive. So usually starting with topical therapies like minoxidil, or name brand is Rogaine often, talking about potential oral therapies that we could consider. So for men, Propecia or finasteride, which is the generic name, is FDA approved to treat hair loss, particularly male pattern hair loss. In some women, we will use that off-label, particularly in women who are postmenopausal. In women who are premenopausal, I don't often want to use that, so I'll talk about other therapies like spironolactone, which is an oral medication that helps block hormone receptors at the hair. It can also be effective for hormonal acne, so I have a lot of women who are like on crossover
Yes.
therapy because those things sometimes go hand in hand, especially if you're somebody who suffers from something like polycystic ovarian syndrome, or there's other conditions that you may have hair loss and acne that go together. And then more and more, there are studies that are talking about oral minoxidil. So I actually use that in quite a few people. So instead of just the topical form, there's actually an oral pill that used to be used as a blood pressure medication. Again, these are all off-label therapies, meaning they're not FDA approved for that specific cause, but we know that they help grow hair in clinical trials. And then I move into certain procedures that we may do in the office. So platelet-rich plasma or PRP injections are something that have been shown in multiple clinical trials to be helpful for androgenetic alopecia. So I talk about that and how they may come into the office to get that therapy, all the way up through hair transplantation and what that would look like and would they be a candidate. And so it kind of runs, when you have someone who comes in for hair loss, there's a lot that goes into the assessment and trying to figure out what bucket they fall into, because there's actually lots of different types of hair loss, right? It's all not
Exactly.
And then there's lots of different therapies. So you're
Right.
giving people a ton of information all on time, which is really overwhelming. But you have to go through that like very stepwise progression, because each of those different types of hair loss, once you've identified it, they may have different therapies that are appropriate.
True. I feel like I kind of go through it all and then they sort of have to digest it, and I try to whittle it down, and then I give them a card with it all written down, but it's true. And
then I also, the other thing I ask when I'm talking about therapies is like, realistically, what's going to fit into your life? Right. Are you somebody who's going to put on a foam or a liquid once or twice a day? If you know that's like not you can barely put on sunscreen in the morning, that's not a good option for you.
It's true.
Right? So I have a number of patients who don't want to take prescription medication. So what would that look like? How could we create a plan that's tailored to their needs and what fits into their lifestyle? And I think that is something that you really have to consider.
I think with a lot of what we do, we have to meet someone where they are. And that's what's nice about having so many options. But I think for those out there that are not dermatologists who have joined, is just to know that we as dermatologists are experts in hair as well as skin and nails. And you might not think to come to your dermatologist for a hair issue. But really, this is part of our intensive training, because if you think about it, the scalp is skin just under the hair. And really, too, we know that if you want to have healthy hair, you need your scalp to be healthy. And so that's where a lot of our training is, what's going on at the hair follicle level, and that affects your hair. We did have a question about mesotherapy, whether vitamins and peptides injected sub-Q can be effective in hair loss, which we can talk about whether injection of them, but you definitely talked about checking someone's vitamin levels in general. So I feel like certainly checking vitamin D levels and things like that, and making sure those have been repleted. Beyond that, as far as I know, there's no real medical evidence, supporting that.
I think there's very little evidence, especially for mesotherapy of vitamins, like for injection of vitamins. Typically, when we think of the literature that's been published, injections in the scalp typically involve either steroid injections for somebody that has a lot of inflammation in their scalp, or platelet-rich plasma injections. Those are the most common, that have the most literature to support their efficacy in hair health and scalp health.
I have a lot of patients that ask about platelet-rich plasma or PRP, and I, as you, have found that there is clinical evidence supporting it, and anecdotally, I have found patients to be happy with it because I think I give them reasonable expectations. How do you do PRP therapy in your practice?
So I ran a large clinical trial studying the frequency at which you should be treating for PRP to get optimal results. And so I counsel patients so just take from a big, like kind of big perspective, I counsel patients that PRP is part of their main, it's part of a long-term treatment plan. It is not something that you come in and you do a single injection and you're going to grow amazing hair and it's going to stay there.
Right.
This, hair loss tends to be a chronic process, especially if you're talking about male or female pattern hair loss. It's something that stays with you, as opposed to types of hair loss. There's something called telogen effluvium that's gone way up during the pandemic.
Yes, we can talk about that too. Yeah.
Yeah, that may be more of a finite experience that someone is having. But for patients that have, continuous hair loss, PRP is a therapy that they're going to be doing on an ongoing basis. And I talked to them about initially when we start therapy, we're going to do more frequent treatments. So I start someone off at 1 a month for 3 or 4 treatments. And then we start spreading them further and further apart. So the thought is that there's like kind of an induction period, right? There's a part where you're trying to increase hair growth. And then once you've increased hair growth, you're trying to maintain hair. And so you can spread treatments out further apart in order to do that. It's really important anytime you're using platelet-rich plasma, whether it's in dermatology or any of the other medical fields, that you prepare your PRP with an FDA-cleared system. So many people draw labs in their office, and they have centrifuges, which are basically these little machines that spin really, really rapidly in order to process blood like you would for normal labs. Those lab tubes and those centrifuges are not, they're not sterilized and they're not treated in the same way as a PRP specific kit. And so it's much safer and you get much better results when you're using a true dedicated system. And that gets into a lot of there's a lot of technical aspects that are still being fine-tuned and figured out, some of which we know, some of which we don't know. And that's where I think from a scientific standpoint, that's where a lot of the interest in PRP lies, in trying to create more predictable treatment plans. So that, I think one of the things that is disheartening for patients is like when they go online and they can see, there's mediocre reviews, or it worked really well for one person and didn't work for another. And that's because there isn't a lot of consistency between providers. And so we're trying to make that much more of a consistent process, and hammer out what are the best characteristics of the PRP, since it's not something that comes like prefabbed. I talk about it as in compared to other injectables that we might use in the office, that come and we know exactly what is in that syringe. You don't know that for PRP.
Exactly. And I think that's why you need to know who is doing your treatment,
right,
and that you're going to an expert. And it's okay to ask like what they're board certified in, because it can be confusing. And you want to make sure, look, you're injecting a blood type substance back into your skin. It's your own blood and platelets. So you want to make sure that they're doing it in the proper sterile way. That's part of our training, and that you trust the person and you ask them what results they've had, and, talk to them about how many they've done. And like you said, the devil's in the details, and, it really depends. You have to, just because you do PRP in someone's joints doesn't mean you can then do PRP for their scalp. And so, it's all of these things that maybe people don't think about, because how would they know? But I think it's really important. I've had good results too. I personally have had PRP for hair, but like you said, I tell people first, maybe they would notice decrease in hair shedding. And then after that, they might notice that the hair quality is better, and that the hair follicle, the hair shaft will be a little bit thicker. And then last would be maybe hair regrowth. And so I feel like with all of that, they're happy. But I'm sure like you, they ask like, when can I stop this? And I say, that's
when you don't care anymore.
Right. That is literally my answer.
Yeah.
When you stop caring. So whenever.
And that's almost exactly the order in which I tell patients that they'll experience changes. Like first you'll probably see less shedding, then you'll have thicker hair shafts, and the quality of your hair will improve. And last but not least, you will see increased hair growth. And I set the expectation that we're going to do basically a 6-month period of time. At 6 months, and I do that for most hair loss therapies, at 6 months, if we're not seeing anything, we need to touch base, regroup, think about, do we want to continue on this for up to a year? Do we want to change gears entirely? and that becomes a very individual,
Right.
specific
Right.
conversation.
And we tailor, because I think that most of the best results are combination therapy, and we're trained to combine medical with, PRP, and to understand. And also, we as physicians have to know what other medicines they're on and understand how that affects, especially if you're on something like spironolactone,
Right.
and check their potassium. So it's good to go to a physician, who understands all of this and can be done safely. You mentioned telogen effluvium. I've definitely seen that. So tell us a little bit about telogen effluvium.
I was like, I feel like that's been like one of the themes of the pandemic.
Yeah, definitely.
So telogen effluvium is essentially when you have abrupt changes of hair from a growth phase into a resting phase. And so, typically we have hairs that are in multiple different phases on the scalp at any given time, but when you have a large number that go into a resting phase, you start shedding really profusely. And it tends to be abrupt onset, usually triggered, 6 weeks or so prior, by some kind of traumatic event, whether that's like emotionally stressful, you had surgery, you were really sick. So something that has pushed your body kind of over the edge, and the body decides, okay, I have a finite amount of resources. I'm going to save those reserves for my heart and my brain function, and hair is accessory. And then you're not giving all of that attention to the hair. The nice thing about telogen effluvium, nice in quotes, is that it's not permanent. It is a process that your body goes through, and typically you shed, for a number of months. Then the shedding stops pretty much as abruptly as it started, and then you go into, you try and regrow that hair. And it takes about a year to get back to where you typically are, I tell patients. And so it's a process that your body goes through but recovers. And so that hair, is not permanently gone. It can be pretty, I'm sure you've seen a lot of patients recently with this. It's pretty traumatic when you start losing, shedding massive amounts of hair.
It is that these are some of my most upset patients that come to you, and they take a long time. And I understand, and maybe they've seen other practitioners who've maybe thought that they were, not telling the truth, but I've learned that people are very aware of their hair specifically, and they know when small changes happen. Even though they might still look like they have a full head of hair, they understand that it's much different than it used to be.
And I think that's one assumption that people make is you look like you have a lot of hair, so it's fine.
Right.
But that's all relative, right?
Exactly.
Someone can come in and bring a picture of themselves from 5 years ago, and they have twice the amount of hair, and they still have really thick, dense hair. But for them, that is hair loss, right?
Exactly.
So you have to kind of reserve judgment and really dig into what's going on, and understand where they're coming from and what their baseline is.
I do tell them, like most things, unfortunately, the older you are, when you have the shedding, it's harder to get all the way back to your baseline. Yes. I say it sometimes almost uncovers a predilection towards androgenetic alopecia.
That's exactly what I say.
I have to just, make them aware of that. And then back to other hair loss, and particularly hair loss treatments. I'm sure you see this where some men, and some women come in and there's no longer any hair follicles present or visible. And I talk to them that maybe at that point, those hair follicles could be gone. And so that's not so it's like a lot of things where it's better to come in sooner than wait, because the sooner it's addressed, the more likelihood that you'll get a better outcome.
100%. There's a type of hair loss called traction alopecia, which is, typically from wearing your hair up really tightly, and you start to get like recession at the sides of the hair. And there are other patterns. There's some really interesting patterns based on like activities that you do. There have been reports of ballet dancers and Irish step dancers who wear like really heavy hair pieces, and because of the pressure from those hair pieces, they get lost in those areas. But that initially starts as a reversible process, right? So the trauma to the hair follicles, if it's aborted and you stop whatever you're pulling or braids, whatever is causing that traction, if you stop it, that hair will regrow. At a certain point, those follicles scar down, and then the potential for regrowth is no longer there. So when you start to notice those changes, that's when it's really important to seek out, a board certified dermatologist, somebody who's an expert in hair medicine, because they can look at and counsel you on appropriate therapies. The other thing that we do, if we have any question, is that we do a scalp biopsy, and that's not something that you can get at every facility. Not everyone knows how to do it, but it is a great tool, and we send those to specific pathologists, so specific physicians who look under the microscope, who are trained to look at hair follicles and to make diagnoses based on what they see specifically around the follicle.
Exactly, and do a biopsy, and then sometimes we even have to go a step further to look at autoimmune and do a specific immunofluorescence. And so these are things that I've seen, because I'm sure, like you, I almost become like a tertiary referral center for hair, and also they may be seeing some, less specialized practitioners and have a pretty good workup, but it's just taking it to that last step to really try to get to the bottom of it. Back to what you said about traction and good hair practices, I do find it so hard sometimes, because people will say that they've done these things for so many years and it's never been a problem. But I do like to tell them, at some point, that trauma to your hair gives in, and your hair can be different than somebody else's. Your relative or your friend could have hair that can withstand more than yours, and there's really no way of knowing that.
Right. No, 100%. It's such an individualized, experience, and what may tip somebody over the edge to start experiencing traction or other types of hair loss, and somebody else goes through the exact same experience and doesn't have that. You have to really listen and kind of set expectations and how you might modify. And I think that gets into also talking about, which there is a lot of literature, there's a lot of Instagram posts about skincare. There is not as much about hair care and good hair health habits. And so I think that gets into then counseling people about, how to take care of their hair and their scalp appropriately. So wearing your hair, if you're going to wear it up, to do it as loosely as possible so that there's not as much tension. To not sleep with your hair when it's wet, because that's when it's the most vulnerable to breakage. Little things like that, I don't think we talk about enough, and aren't kind of discussed enough on some of these platforms. But dermatologists are the people who have spent those years studying it and understanding the medicine behind that, and why you might be more vulnerable your hair might be vulnerable in a wet state as opposed to a dry.
Exactly. I don't think people really realize that when their hair is wet, it is in more of a vulnerable or weakened state. And so by gently combing with a wide-toothed comb, when it's wet, or not really even combing it at all, if you can get away with that, it is helpful. Or recently, I was talking to a patient about not, using a lot of friction with like a rough towel to dry it, because they didn't understand why they were getting a lot of like friction changes to their hair. These are small things, but if you think about it, the hair is existing outside of your scalp for a very long time, depending on how long your hair is, and all of those sorts of things, build up as far as trauma. What about, go ahead.
I was going to say, it's largely made of the same protein that our skin, the top layers of our skin, are keratin. But it's an extension of that, and it's not having the same nourishment, the same replenishment that your skin has when it turns over so rapidly. And so, as it gets, further and further, longer and longer down the shaft, it becomes much more vulnerable to breakage and other damage.
Exactly. And, I tell people all the time, when they're treating the skin on their face, that they oftentimes can treat different areas of their face differently. Like the center of your face is more oily than the perimeter. And I say that same thing sort of with hair care. You really want to shampoo mostly your roots, where most of the oil is. I think people don't understand maybe why they say that they don't want to use a conditioner because it weighs down their hair, but trying to, understand that really, if you just sort of start midway and then down, hopefully most of the time you can tolerate a conditioner.
Right. I try and divide it for people into like hair care and scalp care.
True.
So they kind of understand like what's working at what level. Because I think, a lot of times, a good example is like dandruff shampoo. People, it's called a shampoo, so they think, oh, I'll just lather it all up. It's really a scalp treatment, right? So you want to get it into your scalp, and you want it to sit there for a little bit so that it can actually take an effect. And so even by using tiny tips like that, you can really make a big impact on the quality of their scalp, the condition, whether they're having dandruff or other complaints. And I think that that's really important.
Yeah, I agree. I mean, especially scalp conditions like dandruff or yeah, like flaking, dryness, itching. I've had a lot of patients with that in the past, and I find that a lot of the medicated shampoos that they were trying either didn't address itch, because you know this, that really there aren't any over-the-counter shampoos that have topical cortisone, or a lot of shampoos have not come as far as like technology in their products, ingredients, as skincare. And so the product may help your scalp, but it really does not protect or improve the health of your hair. And so I really think that's where, you know, kind of improvement needs to happen. There's shampoos that really are great for hair, and there's shampoos that are really great for scalp, and, you know, working to kind of meld those, I think is important.
This is like this is a pre-pandemic statistic, and I think like in the last 2 years, skincare and hair care has had kind of, that whole industry has blossomed even more. But prior to the pandemic, hair treatments and hair care was a $3 billion industry. And most of those products have little or no science behind them.
Right.
And so trying to figure out and navigate like what's going to be the most appropriate for different conditions or for different hair types can be really tricky.
It's true. I mean, just as many skin types, there are hair types, and, you know, what might work for your, you know, straight, fine, thin hair is not going to work for your friend with coarse, curly hair. And so to have one shampoo for the both of you is not going to be sufficient.
When you talk to patients, do you talk to them about like nutraceuticals and supplements?
I do. I find that patients really respond to it because, like you said, some patients want to start that way because they don't want to jump to prescription medicine. A lot of them have already tried in their own way nutraceuticals because they've tried biotin and things like that. And I tell them that, you know, biotin can help, you know, strengthen hair, really. It's, you know, helps with the building blocks, but it doesn't really help the other things that we want it to do. And there's not a lot of medical scientific story with that. So there's two that I recommend that have been pretty common on the market. There's Nutrafol and Viviscal, and there's many different versions of them, but basically they have biotin and copper and zinc in them, but they also have other ingredients that, granted, these studies were sponsored by those companies.
Yep.
But there's a little bit of science behind them. Nutrafol, as you know, has saw palmetto, which is somewhat similar to how we think finasteride works. And Viviscal has, you know, proprietary other murine extracts. And so, you know, I talk to them about the fact that these are not FDA approved because they're nutraceuticals, and that there's no double-blinded clinical studies, but, you know, this is what anecdotally, and you can try them for 90 days and see how you like them. And I do find that people really like them.
I do too. So I have a very similar discussion with people, and I find that they tend to, it resonates. You know, they, for whatever reason, people typically feel more comfortable starting with a quote vitamin than they do starting with a prescription medication, and so it may be an entree into other therapies down the line. And for a lot of people, you know, if it doesn't necessarily grow more hair, they do often help with hair quality.
That's very true.
And people, and you know, that is something that they can, is very notable. Maybe their hair grows faster, maybe their hair feels, you know, thicker to the touch, or, you know, is easier to style, is less coarse. All of those things are, you know, metrics by which patients are kind of gauging these different therapies. You know, I talk to them about both of them. Both of those two are have backbones that are based in like basically a seafood and or fish protein. So it's a marine protein. And so if you're somebody who's vegan, they may not be appropriate. And if you have a shellfish allergy for the scalp, is their proprietary ingredient is based on shark cartilage and oyster shell extract. So that may not be the option for you.
Right.
I think you summed up biotin really nicely. I generally try and get people off high dose biotin because we know that it doesn't largely promote hair growth unless you have true biotin deficiency, which is exquisitely rare in the United States, and you have a whole lot of other symptoms besides just hair loss. And actually, high levels of biotin can interfere with some of testing for other organ function like thyroid and heart. And so someone can be having a heart attack and that high dose of biotin can artificially change their labs. And so I tend to try and get people off of that.
Exactly. I mean, the biotin industry has definitely done really well.
Your neighbors like try biotin.
Yeah, everybody says try biotin. What about like laser comb, low level light therapy?
Yeah. So low level light therapy is another another treatment modality that does have some data behind it. These are like helmets, combs, wands. Some of the devices have more studies to support them than others, but there is some interesting work going on about how that light may modulate some of the inflammation and other factors that are going on at the scalp. I talk to patients about that as a potential. I don't usually use it as a standalone therapy. It'll be something that's like an add-on or an adjunct to things that we're doing. And my personal opinion is that there are certain people that are better. Part of the variety of response that you might see is there are certain people that are better candidates than others. And one of the ways that I help kind of distinguish that is whether the light's going to actually get to your scalp. So if you have, thin, straight, light hair, and the tongs from a comb or from a little helmet that looks like a bike helmet that you wear for like 20 minutes 2 times a week, because my husband wears one. He was my first guinea pig. I was like, before I start trying this on patients, I need to know if this works. So you're going to get a helmet. You get to try it. And he works from home, so it's okay. It works in his schedule. So whether that light is actually going to penetrate to their scalp, that person might be a better candidate. If someone has really tight, coarse hair and those tongs are just going to kind of sit on top of their hair and not get in, they may not see as much benefit. Aside from that, I still have a difficult time predicting who's going to be a responder and who's not.
Me too. I mean, I say the same. I definitely tell them that can be an adjuvant therapy, and it is one of those sort of at-home devices that really relies on compliance. So if you're really going to do it, then it potentially could work. But if you're one of those people that is not, it's very expensive and it's not going to be covered by your insurance. But the few people that I literally just saw a woman today, I mean, granted, she's on a lot of things, including topical minoxidil and all those, but she also isn't doing low level light and she's very happy. So I do think that it is hard to say because you can't tease out and do like a split head study. So I really don't know what's working. But
and the difficult part, with designing and tailoring a treatment plan for hair loss is your gut inclination is to jump to like everything in the kitchen sink because you're really stressed out by the fact that you're losing hair, so you want to do everything. And I tell people, okay, that's one approach, but if we do everything and you get good results, now you're kind of stuck doing everything because we don't know what is causing what.
True.
And so I try and like limit people to, we know combination therapy tends to work better. So I limit them to like a small combination and then we add on typically as we go.
Exactly. And especially if other combinations work at different parts of the pathway. It's instead of doing 2 things that kind of are,
hit the same, hit the same target.
Go ahead.
No, I was going to say the other thing I talk about in terms of combination therapy, that extends all the way to hair transplant. So if you have a hair transplant, that means they move hair from like typically the back of your scalp up to the crown or the area that has been thinning, but you can still thin around that. So you still have to continue doing maintenance therapy. So they'll often have you on oral pills, topical therapy, There's some literature using PRP in combination with hair transplant. So it's not like even that is not like a one and done thing. It's something that is part of this continuum, and part of that spectrum of combinations.
I think that's a good point, because I don't think some people realize that.
So,
They think that that's going to be the end, and then they can just live with their full head of hair forever. I wish that
right.
was true. And as you know, men and women can do it. Women tend to do really well. I don't personally do hair transplant, but for some women, it's a good choice. But it is, it can be expensive, and you have to, like anything, find the right surgeon.
Correct. And I think it's also to note that you can do hair transplant in other areas other than the scalp. So
Yeah,
you can do eyebrows. So for someone who has had like a scar or something that has caused them to lose a large portion of their eyebrow, you can actually transplant hair into that area. And so it is a really nice option for many people.
definitely. Um, Somebody did ask briefly about carboxy therapy. Um, they asked if it's approved. I definitely know it's not approved, but I don't know any anecdotal stories about carboxy therapy. Have you read about
I
that?
have not seen a ton of literature for carboxy therapy specifically for hair growth. You know that it's being used in rejuvenation and other areas for study, but not as much for hair.
Yeah, yeah.
I think there was like two. I just found like another
Oh,
way
good.
to look at questions. Okay, so someone was asking, does the meal hair oil work for faster hair growth? Mielle for those who,
Oh,
um,
I don't know that hair oil.
I don't either. So in terms of hair oils, probably the most data that's out there, and there are just several studies. Rosemary oil can work for hair growth, for about faster hair growth. That has been published. So I actually have a couple patients that on their own decided they like looked up the literature and decided they wanted to use it.
Right.
And so there are oils and there are homeopathic treatments that can be efficacious. It's just a question of figuring out how that fits into your lifestyle and your regimens, along with other medications or other in-office procedures.
Exactly. And we touched on it, but if your scalp is inflamed, I don't think people kind of connect that inflammation is almost like chewing away at the little hair follicle before the hair can even come out. And so I think that's why people who are scratching their head a lot or have dandruff or scalp psoriasis, their hair will look better when they get their scalp, in check. And who knows, some of these oils may have some anti-inflammatory
Yeah.
component to it. It's hard to know. Plus, they're coating the hair, and so maybe they're decreasing breakage. But you know, as far as we know that I always tell people in the extreme, alopecia areata is when it's all of the little lymphocytes have gotten rid of that small patch of hair, and the hair kind of gets broken off before it really comes out. And so scalp psoriasis and dandruff and all of that are just other smaller iterations of that. And so by doing things like topical cortisone, or sometimes even with alopecia, as we even inject local cortisone into the area for periods of time to try to get the inflammation down. It can be very helpful. But I, like you, tend to mostly see conditions that are not really inflammatory.
Mm-hmm. Well, the most common types of hair loss tend to be non-scarring hair loss. So male and female pattern hair loss, androgenetic alopecia by and large is the very most common type of hair loss. Telogen effluvium is quite common. And then alopecia areata would be another one that I would throw in there as a more common type of hair loss that does have inflammation, but it's not typically a scarring type of hair loss. The other inflammatory hair loss conditions tend to leave you with scarred down hair follicles and tracts from that inflammatory process, and they have to be treated a little bit more aggressively and differently.
So somebody asked if we had talked about PRP, that they had joined late, which we definitely did talk about PRP. Yeah. We basically summarized that that there is some clinical data behind it, and that we have anecdotally seen some good results, but you really have to be careful who's doing it. Make sure that they are doing it in a approved system that is sterile and, well maintained.
And I talk to people about the potential mechanism that we have seen in, basically in vitro, so like, or in vivo and in vitro. So if you look at something where they bathe like the hairs and they try and figure out how this is functioning, they think PRP through its signaling molecules. So essentially PRP is small volume of plasma with a large concentration of platelets, much higher than what's in your circulating blood. Those platelets are chock full of signaling molecules. So those are growth factors. They're the way that cells communicate with one another. And when you put them in an environment around the hair, what's been published, what they think is that they decrease the amount of inflammation around the hair follicle. They get the hair follicle to shift into a growth phase and stay in that growth phase for a longer period of time. And then you also get more little tiny blood vessels that grow in, so you get better nutrient supply to the hair and the scalp. And so through that combination, and there's like very complex mechanisms and cascades of different signals, through that combination, that's how it may be promoting hair growth. And so when you were talking about using that, using therapies that have different or complementary mechanisms, I look at PRP as one thing. There was a study that was published that compared PRP plus topical minoxidil with PRP plus oral finasteride, which, if I was going to bet on it, I would think that the PRP plus the finasteride would have had a better outcome. But in fact, people who did PRP plus minoxidil, and this was a small study, but those patients did better. And they think it's because the minoxidil has a complementary mechanism. And so that's why you really want to see somebody who is well versed in all of these different therapies and what may complement or what may actually impede. There may be therapies that interact, and how you would put that together.
Exactly. And minoxidil is an interesting one because the generic and certainly the brand Rogaine, it has a really high percentage of something called propylene glycol, which I am highly allergic to. So I have sometimes compounded minoxidil for patients because if you find you are getting irritated by it, you could have an irritant or an allergy to what it's in.
So that propylene glycol is interesting because a lot of people can have irritation from it, which will make them not tolerate the therapy. But on the other hand, it also increases the penetration.
Right.
And so in the solution form, that's the form that typically has the most propylene glycol in it, you will get a little bit better results because of that. I also find that for women, they tend to like solutions better because it's a lot easier to put on long hair. So you can like part your hair and drip it onto the scalp and part your hair and drip it onto the scalp. Whereas the foam, which is actually the 5% that is FDA approved for women, the 5% solution is not FDA approved for women. It's considered an off-label use, but that's typically what I will start with. The foam is very moussey and goopy, and if you have long hair and you don't wash it every day, that can sometimes be a deterrent from therapy.
Well, I think that's the thing. Out of all of the treatments, I think I have people who are willing to use topical minoxidil the least because, women, because I feel like they are already not washing their hair every day and they don't want to apply it every day. I mean, the ones who are very dedicated, but I would say in general, they're usually using other combined therapies. But and I have, like you, used off-label, very low doses of oral minoxidil and had good results, and spironolactone off-label, and postmenopausal women on finasteride off-label. So I think you have to kind of speak with someone who's qualified and go through it.
Yeah, and it's really important that they understand like your entire medical history. So you want to see someone who can really understand all of the side effects of those medications because they're appropriate for different types of people. And in the context of your general health, why you may or may not be a good candidate. For instance, very low dose minoxidil. So typically minoxidil, when it was used for blood pressure, The problem was that people would have, decrease their blood pressure, but they would have increased heart rate and sometimes have irregular heart rhythms called arrhythmias. And so that was one of the big things that actually basically caused it to stop being used as a blood pressure medication. At low doses, you don't typically have those problems. And we're talking about, a fraction of the dose that was used for blood pressure medication. But if you're somebody that has a history of cardiac disease or has a pacemaker or all of these other things, you may not be a good candidate for that. So understanding how it fits into your health as a whole is really important. And that's where we can come in and help guide.
Exactly. And that's what informed consent is, and going over all the possible medical interactions. And also I have them review it with their primary care doctor, or if they have a cardiologist. I mean,
Yep.
I am the first one to say I want to sleep well at night. It's all a risk benefit situation. So, we have to kind of realize what we're dealing with here. But yes, I think with a thorough history, we all fortunately, have that medical background. And so being with someone trusted, but we also keep a very close eye on them. Lab work, if they're on spironolactone, measuring potassium, any other sort of labs that need to be checked, hormonal levels and such. So I agree.
And so in our practice is actually kind of interesting because one of the other physicians, so there are 2 plastic surgeons in my practice, and one of the other physicians is fellowship trained in breast reconstruction. So we have a number of breast reconstruction patients, who have done chemotherapy, who are on, multi-year courses of tamoxifen or other anti-estrogen therapies. And those can all affect hair growth and hair quality. But you also have to think about how the medications you might start to treat that hair loss will interact with those therapies. And so I'll usually have speak with their oncologist or get some kind of consent from them.
Definitely. What do you tell people about hair dye, like hair color and hair care?
I think the least, I tend to, I let people dye their hair. I don't, I tend to try and steer them away from using like heavy peroxide. I think that's the most damaging, the most stripping to your hair. And if someone is coming in specifically complaining of hair breakage, then I often will assess like hair dyeing behaviors and how frequently they're doing it, and whether there's some kind of like, semi-permanent or something that is like less detrimental to the hair that might be an alternative.
No, I agree. I mean, as someone who is going gray,
my mom went prematurely gray, so she dyes her hair like every 2 to 3 weeks. So it's like, it's always been like, it's always a discussion.
But it's, I really do try to follow that rule of, that darkening your hair is not as damaging as lightening your hair, and certainly not lightening your hair like more than 3 shades. And, really once you do that damage and that breakage, especially in the front of your hair, it's very hard to get those hairs to grow back. And I try to explain mostly to women, because they do more to their hair, that as our hair follicles are aging, just like in men, but they don't think about it, the hair follicle is shrinking. And so then therefore the hair that comes out is thinner and it breaks more easily. And then once you add heat and dye to it, it's just a perfect storm of breakage. So
I was going to say the heat styling is the other thing that I talk to them about with that, especially with that frontal breakage, that makes it really difficult. There are, in terms of talking about like scalp health and products, because, I get asked about like shampoos and things that I would recommend. And that is, as you said, like it is not a field that is as well validated as skincare. So if someone were to ask me what my like holy grail for skincare, I would say, a sunscreen, a retinoid, an antioxidant like vitamin C. We can all list those really rapidly off the top of your head. If someone asks you what is your holy grail for like hair care, you're kind of like, do they have a condition? Like,
exactly.
Are we trying to treat something, right? But there are a couple products that are out there that I think that the science behind them is interesting. Now, do I think it meets the level of like requirement for evidence-based medicine? No, probably not. But Olaplex, which is pretty readily available, and there's another one called K18. Those are both products that are intended to restore the bonds in your hair. So the hair is held together by these things called disulfide bonds. And when you overheat, style, or process your hair, those bonds break, and that's part of what weakens the hair. And so those products were designed by, medical chemists, and I think Olaplex is like, I think, two by chemistry PhDs. K18 has a medical advisor that actually published a lot on a specific protein that they found was helpful in restoring hair health. And they used a synthetic form of that protein in that product. And so those are things I think that are interesting, and maybe what we will see in the future when we talk about, hair care products and how we can elevate them to the level of like skincare.
I agree. I mean, I'm more telling people what they should avoid in hair care at this point.
Yeah.
They should have in. So, just literally talking about sulfate free and why that matters. I mean, it doesn't matter to everybody, but if your hair is already dry, I go through that whole thing of like, it's almost like using a really harsh foaming cleanser on your face, and your face feels dry and tight. That's what you're doing to your hair, and you wonder why your hair is like a frizzy, brittle mess. Well, it's just the cleanser that you're using. And so it's great when you see people with like the light bulb that goes on. And so, I feel like most of the patients I see have dry, brittle hair. I mean, that's generally because of all the things that we're doing. Even at a younger age, I mean, my teenage daughters are already dyeing and straightening their hair. I'm like, oh my gosh, your poor hair.
And when you think about like the other one that comes up a lot is like dry shampoo. So like,
Yes.
dry shampoo is really convenient. Yeah, and you can use it in moderation, but too much dry shampoo just sucks up all the oil from your scalp. The oil on your scalp is meant to hydrate your hair. If you get rid of all of that, you're gonna have to create more problems. It becomes like a vicious cycle. So
it's true. Everything in moderation. All right. Well, I feel like I've covered my list of topics. Are there any questions we answered?
I think we had covered, and I was trying to see if I'm just scrolling to see if there are any little questions that we missed. There's another question about mesotherapy, talking about how it's frequently done in their country, especially for like telogen effluvium and hormone therapy loss, so peptides and vitamins. We talked about that earlier, but there's very little evidence to suggest that injecting vitamins can abort telogen effluvium or reverse hormonal deficiencies that are affecting the scalp. But I think that was the only question that we didn't touch on, and I think we covered most of the general points that we were hoping to.
Wonderful. Oh, what do you tell patients who want to get extensions? Well, I can tell you what I do, but
lengthy.
Extensions are, I kind of think of them as almost like fake nails. I mean, they look really good, but they're probably doing more damage. And I feel like they're good for an event or for a specific period of time, but it depends who's doing the extensions. Some extensions are better than others. But if you think about it, they're just weighing down your hair and chronically sort of pulling. And so I feel like it's a net at least equal to slightly negative for your actual hair. But I do have some patients who have gone through some significant hair loss and really do not want to leave their house without some form of an extension. And at that point, it's their mental health. So, the goal would be to try to do something to get them away from the extensions. But if you do feel like you need them, it's finding a really good stylist that does this at a high level.
I couldn't agree more. I think that, ultimately the goal is to like wean people off extensions, because, right, you're creating more of a problem for yourself. But they often seek out that therapy because they're self-conscious or they feel like their hair is thinning. I have a patient who we have done a combination of steroid injections and PRP, along with some other therapies, but she has female pattern hair loss that was apparent as a late teen, which is really difficult.
Yeah.
Especially if you're a woman, and shaving your head is not really an acceptable option in this country or a lot of society, right? And so she was, she got to a point where she was like, I really want a hair, like I want a hair piece. I feel more comfortable if I have something that I can put on the top. So prior to seeing me, she got this clip-in hair piece. The problem was that the clips were so tight that they actually created like frank areas of baldness. So I really counsel people that they want to get those hair pieces, wigs, extensions from someone who is very well versed and ideally works with people that have hair thinning and more kind of vulnerable hair, because they're going to get the best results with the least damage.
Definitely. And somebody did ask about wigs. I mean, I personally think that some people, need them if they're going through chemotherapy, what have you. With that, I think that doing something to protect, to wear a cap that's protecting your hair, so it's the friction, and then just making sure to have good scalp health, because, it can be sort of occlusive and hot, and you want to make sure that you are washing your scalp regularly.
Yeah.
And then we're having lots more questions now. Somebody's asking about dyeing hair, bleaching hair. Does it cause hair loss? And we touched on this. Unless if you get inflammation in your scalp from it, like you're allergic to the hair dye, or you have inflammation, or you burn your scalp from the bleach, then you get hair loss. But otherwise, it's causing breakage versus technical hair loss. Is that how you would say it?
Yeah. So, and then there was a question about what are our max doses typically for men and women with low dose minoxidil. So typically for women, I usually do 1.25 milligrams. So that's like a 2.5 milligram pill that you break in half on a daily basis. In men, there's literature going up to 2.5 milligrams. I would not go above 2.5 milligrams. I think, the blood pressure dosings typically start at about 10 milligrams. And so I think if you get above 5, you may have more risk of cardiac side effects. And then the other thing that people can experience, you can get hair growth on other parts of your body. So just like with topical, you can get peach fuzz and hair growth on your face or other areas that might be unwanted. And you can also get some swelling in your feet and lower extremities, what we call pedal edema, when you get up into a little bit higher doses.
Yes. And like you said, you have to know if they're on minoxidil, I'm not having them on spironolactone, because those are two things that can lower their blood pressure. So, it's things like that. And you also have to think about the body mass index of the person. Generally men are bigger than women, but if it's, someone who's slighter, you can think about, all of those things. So I just be like, you start low and you can slightly titrate up.
And there is a published paper that had good efficacy with oral minoxidil and oral spironolactone, but they were using them both at very low doses. It was like 25, I think it was 25 milligrams of spironolactone and I want to say 0.5 milligrams of oral minoxidil, so much lower. So when you're thinking about combination therapies that may have some of the same side effects, you may want to start at lower doses of each of those, and then work your way up. Just
that's interesting. I wonder if that together at lower doses is like more synergistic than either one alone.
It's kind of an interesting concept. And thinking about like if you use lower doses but diversify your mechanism of action, maybe you're going to get a better effect.
That's interesting. All right, 9 o'clock.
I'm
a stickler. Plus,
I think it'll cut us off if we don't stop.
Right.
So.
And you're over the Silicon Valley, so you still have time, but I have to get ready for bed soon. So thank you so much. Oh, I wanted to say on my list, that if you are looking for a dermatologist or a board certified dermatologist, or you need to refer somewhere outside of where you work, go to ASDS.net, click on Find a Dermatologist. You will find an excellent qualified dermatologist that way. And I just want to thank you so much for having a great conversation.
This is really fun.
I never knew Instagram Live could be so much fun, so maybe I'll do it again.
We got bi-coastal. We got to do the full country. All right.
All right. Thank you. Have a good night.
All right. Good night, everyone.
Good night.